Honestly, STIs are very common in our culture. And like I said, they're so shamed, we just don't talk about it. They're actually not as bad. A lot of them are not as bad as you might think. They're only bad when they go left untreated.
Welcome to Follow Your Heartsong, where we reclaim pleasure, break taboos, and awaken to our deepest desires. I'm Rose Heartsong, bringing you raw, unapologetic conversations on sex, spirit, and self-liberation. Let's dive in.
The show is about radical authenticity, following your heart song, doing what lights you up, and help you break free from social taboos around sexuality. I believe that when we start talking more about sex and having these taboo conversations out loud with ourselves, learning, educating, sharing, communicating with our partner or partners, that a lot of the challenges that we have that when it comes to sex will start diminishing, and that we're going to start becoming a lot more empowered and motivated and inspired around sexuality. We are going to be talking about something that we don't talk about very often because it gives people the EBGBs and it makes people have anxiety and makes people feel overwhelmed and scared, and people avoid it or don't talk about it or are petrified of it. And that word is STI, STIs. And it used to be called STDs. And I've noticed lately it's been called STIs. I was wondering why. So I did some research in preparation for right now. And it's because doctors are wanting to change the narrative that it's a disease versus a disease to an infection. So a sexually transmitted infection. And as I said, we don't talk about this. We don't talk about it. We don't talk about sex as a community and culture, but we really don't talk about STIs or getting tested, or everybody really doesn't like that word. Condoms are something that we don't like as a culture. And then it spreads STIs. So we're going to dive into that so that you can walk away more informed, more educated, more empowered, more certain, more clear. And maybe some of the fears that you've had about STIs can go away, hopefully. And maybe some anxiety, overwhelm, lack of confidence, fear, scarcity, thinking you're going to die if you have sex. Some people have said that to me. This one, honestly, for me, was so debilitating and scary for so long. Every time I had sex with a new person, I would freak out and have to go get tested, and I thought I was going to die, or if the condom broke and sort of things like that. It literally would haunt me, and I'd have anxiety attacks about it until I started to educate myself. And I do believe maybe potentially they teach this in school, but not really. Oh, I don't think. So part of this education today is for you to feel empowered and to be in the know when it comes to STIs, because if you're having sex, you have the risk of getting one, or you may have one and you don't even know it because you haven't gotten tested in a really long time. So I really want to talk about how to feel empowered around this topic, how to feel clear, how to have no worry or fear or shame around it as well, because there's a lot of shame attached to having an STI, especially herpes. That's a huge one. So how are they spread? Let's go back to the ABCs of sex education. That's where we're going. They are spread through sexual contact. That can be orally, genitals touching, or skin-to-skin contact. Some STIs are viral, some of them are bacterial, and some of them are parasitic. And it's important to know which each one is, how it is transmitted, and most importantly, how to treat it if you happen to get one. Because a lot of people do. Honestly, STIs are very common in our culture. And like I said, they're so shamed, we just don't talk about it. They're actually not as bad. A lot of them are not as bad as you might think they're only bad when they go left untreated. That's most of them. So we'll go into that. So we're going to go into it. Are you ready? Are you ready to pull out your notebooks, take a deep breath. Let's take a deep breath together. Take one more. Let's just get into it. One more. That felt good, actually. Take one more deep breath in and let it out. And I just want to invite you to be aware of any shame in your body through this conversation, or any fear, or any sensations that might be activated or brought up in your nervous system, and just be aware of it. We don't have to make it go away or change it or fix it. We're just going to be present with it because we're talking about some stuff that can be uncomfortable. So we're going to go in. What are the types of STDs and what are the treatments? And I felt very empowered in this conversation when I started to talk to my healthcare practitioner and provider about it and ask questions and get curious and learn and educate myself. And when I started to do that, the fear went away. So I hope a little bit less fear happens for you tonight, this evening. So number one, not one number one, but the one I'm going to go over first is chlamydia. The thing that's the challenge about chlamydia is it is often asymptomatic, meaning you don't got any symptoms. You don't know you have it. There's no breakouts. There's no smells. There's no anything. It just, you got it. And if it goes untreated, it can cause a lot of issues with fertility. And it can cause damage inside when it comes to men and women for fertility reasons. If you aren't asymptomatic, sometimes there are symptoms with chlamydia. It can cause any sorts of discharge, pain during urination, or any pain in your abdomen. That's one to be aware of. It can cause, if it's left untreated, as I said, it can cause infertility. So if you're wanting to have children, make sure you're getting STI tests just to protect yourself and prevent it. It's actually very curable and it's easy to treat. It is, I believe chlamydia is a bacterial infection. I don't think it's parasitic, but it's a bacterial infection. So it's really easy to treat with a round of antibiotics. You get a single dose of 2 different types of antibiotics. Well, a single dose of azithromycin or doxycycline, which is a 7-day course. And if you, by the way, I want to say that if you ever do happen to get any STIs, we'll go into that actually. I'm going to go over each one and then we'll talk about what happens if you get, how to take action and so forth. It's just a round of antibiotics. It's if you have a sinus infection or any sort of cold that's really bad or the flu, this is the same as that. It's just the reason why there is so much stigma around STIs, a lot of them, not all of them, obviously, like AIDS was very horrific and awful. But the reason the stigma is present a lot of the times towards these type of infections is because they're related to sex. And there is so much stigma and frustration and shame and overwhelm around sex and sexuality. So that's why there's so much fear. Usually, also the AIDS crisis created a lot of fear for our culture because it was so absolutely horrific for a long time. It isn't anymore, thank goodness. And anyway, so it's just getting a round of antibiotics. The second one also that's really common. So chlamydia is really common. It's very common. Gonorrhea also is very common. It can also be asymptomatic. It also can have painful urination, abnormal discharge, or pelvic pain. And again, this one is a bacterial infection. It can cause infertility and other complications with your health if left untreated. And it also is a shot. This one's not very fun. I know I've heard about this one. I've never had gonorrhea personally, but this one is a shot in your booty and then a pill of doxycycline. And unfortunately, the issue with gonorrhea is that it is becoming resistant to some antibiotics because it's been so prevalent. So chlamydia and gonorrhea, these two are so important to catch ASAP, like instantly. The longer that you have these infections, the more challenging or impactful they can be on your body. That's why it is important to get tested regularly to catch it. You want to catch it. And if you have any sort of discomfort in your reproductive areas, to make sure that you are proactive. And we live in a really incredibly resourceful place in the United States where there's a lot of different opportunities and places where you can get tested, or you can get it shipped in the mail to you. You can get STI tests sent to you in the mail. So it can be confidential. You don't even need to talk to your partner about it. If you have a concern, you can maybe talk to them about it if you get a positive result. You don't always have to tell everyone. This is about your own personal health and your own responsibility for your body and yourself. There's also syphilis. Syphilis is one of the ones that is a physical experience, and it's usually painless sores. And then it can turn into a rash and flu-like symptoms. And if left untreated, this one is really dangerous because it can cause organ damage. Syphilis, so gonorrhea and chlamydia are done tested wise. When you get tested for them, they're a urine test. Personally, I am a huge fan of Planned Parenthood. I go and get tested there regularly. What I love about them is they're so fast and effective because that's all they focus on is reproductive health. But gonorrhea and chlamydia are done via a urine sample. Syphilis is actually one that you do have to get a blood test for, along with HIV. Those are the two that are going to be a test for that one. And syphilis is penicillin. It's a single injection. This, again, early treatment is key to preventing severe health issues, such as neurological damage. Syphilis is so important to catch. So I'm going to say this over and over again. You got to get tested to be empowered in your reproductive health, to be empowered in your sexual health. It's so important. If you're monogamous, it's important. It's empowering. It's impactful. It's potent to get it. And right now you are listening to KXFM Laguna's Community Radio. I'm Rose Heartsong, and this is called Follow Your Heartsong, where we talk about sex, spirituality, and holistic health. And tonight we're talking about STDs and empowering ourselves in understanding and knowing what they are and being proactive with your sexual health. Because once you are proactive with it and you know what to do and you take action, you could prevent a lot of harm. Then there is the one that everyone's so petrified about, herpes. There's two different kinds. There's HSV1 and HSV2. 80% of the population, I believe it is, I think it's 80% of the population has HSV1. That's mouth herpes. Cold sores. They're horrible. I've got it. I got it from an ex-partner and they suck. I've had two in my life and they're really bad. That being said, I'm not going to die because I have it. It's not the end of the world. It's uncomfortable. It looks awful on my face when it happens and it hurts and it's not fun. Like, I don't feel good, but I'm not going to die from it. And it's not the end of the world. It's pretty common. And I don't get them very often. The primary time in which like herpes outbreaks happen is usually with stress. So making sure that you are and when your immune system is weakened, stress, overwhelm, So in a weird, twisted way, a herpes outbreak is like a reminder to take care of yourself and to slow down and do some self-care and support if you have it on your face. A lot of people are HSV1 positive, don't know it. They've never had a breakout. But if you went and got tested right now, you could come back with a positive and just not know it. So HSV1 can actually be spread to the genitals. So if you or somebody that you're with has an outbreak and you perform oral sex on somebody, you can actually spread HSV1 to the genital area. It doesn't happen very often, but it's possible. Just so you know, so be aware of that, be cautious of it, and make sure to always communicate. If you feel like you're having a breakout of any kind, don't kiss anyone, don't share any glasses with anyone. Really just be self-responsible for yourself. So HSV2 is the genital area one. This is the one that everybody has like so much shame around, so much fear around. It's uncomfortable. Like I said, on your face, it's uncomfortable, but really, in all honesty, it's probably less awkward than having a cold sore on your face. Because when you got a fever blister on your face, everybody can see it. Like, it's obvious. It's there. It's, hello, I've got herpes on my face, just so you know. But that one's considered more socially accepted. And herpes on the genitals, uncomfortable, not fun. I don't know. I don't have it. Thank goddess. But I know a lot of people do. And there's a lot of shame around it. And it's really about taking care of yourself, eating healthy, eating foods that don't activate it. There are different foods that you can eat that prevent it. And then there's also foods that you can eat that keep it or activate it. So that is something to think about, is if you have it, making sure to take care of your diet and making sure that you take care of your health, regardless if you have it or not. Actually, it's really important to take care of your diet and take care of your health. And it's important just to be effectively, actively aware and responsible for the situation. If you have herpes, people say, it is said medically that you can transfer it without an outbreak. I have been tested for herpes. I'm a negative, and I've also had sex with people with protection that are positive. They didn't have an outbreak and I didn't get it. So you won't always get it. It's not like a complete, if you have sex with somebody who has herpes, doesn't mean you're going to get it, but there is a chance. There's always a chance. It's important to talk to your partner if you have it. Being embodied and clear and confident and making sure that the person that you're sleeping with is consenting to it, right? But like I said, you're not going to die. It's not the end of the world. It's an uncomfortable experience for a period of time. It's somewhere where it's private and won't be seen. So the world doesn't need to know about it. You can tell if you have a partner, hey, I have an outbreak. You're just not supposed to have any sex during that time. But you guys can be intimate and connected in any other time. So some of the foods that help to prevent herpes outbreaks are lysine-rich foods. So dairy, such as high quality dairy. I'm really into A2 dairy, regenerative farm dairy, grass-fed dairy, making sure that the cows are taken care of and healthy and really nourished is really important. But yogurt and cheese, fish, like such as salmon and sardines, chicken and turkey, legumes, lentils, chickpeas, black beans, spinach, kale, beets, and cauliflower, and then apples, pears, and figs. And then also immune boosting foods such as garlic, ginger, turmeric, leafy greens, zinc-rich foods. These are really good all the time, but these help to prevent herpes outbreaks. Pumpkin seeds, chickpeas, and cashews help fight infection. That is so cool. I didn't even actually know that. I just did a little search because I wanted to help you guys figure this out. And then probiotic foods. I'm a huge fan of probiotic foods regardless. That's kimchi, sauerkraut, pickles, making sure that when you're doing probiotic foods, it's literally just salt and water fermented. I love Bubby's pickles. Those are the best because they're so clean and really full of probiotics. And kefir to help with gut health as well. So the foods that can help to trigger herpes outbreaks if you happen to have herpes. By the way, herpes is a virus. There is no cure for it, but there are immune suppressant or virus suppressant drugs you can take to help prevent outbreaks. But they don't always prevent outbreaks. And then also just to know which foods to avoid to make sure that you don't have an outbreak. So peanuts, almonds, walnuts. I know walnuts is one. Sunflower seeds. Anything with high arginine foods can trigger it. So chocolate, caffeine and alcohol, processed sugars, refined carbs, white bread, pasta, and sugary snacks. We should be really avoiding these anyways. And then acidic and inflammatory foods. Tomatoes could be really bad, citrus fruits, or spicy foods. Yeah, drink a lot of water too. And just keep your immune system strong if you have a strong immune system. There are antiviral medications that you can help to reduce the symptoms or the frequency of outbreaks and transmission risk. So do talk to your doctor about that. It's really helpful for management. And then there's the really bad one that we do know is pretty challenging to have, but it is not a death sentence anymore. And you can be untransmittable if it's undetected, is HIV. The early symptoms are flu-like symptoms. And if they're not taken care of, it can turn into AIDS, which weakens the immune system and has killed a lot of people. This is also a blood test. It's the easiest test. It's literally a prick of the finger and you find out your results in 15 minutes. This one I highly recommend getting tested and talking to your partner about when the last time they got tested was and who they'd been with. There's Antiretroviral therapy is a lifelong treatment that keeps the virus under control. When HIV is undetectable, transmission is very low and unlikely. Early treatment is critical, again, for preventing progression to AIDS. My goal today with talking to you and having this serious educational conversation about STIs is it's important you get tested, because if you catch it early on, it's not that bad. If you don't catch it, it can really hurt you. So make sure to get STI tested. I suggest every 3 to 6 months, definitely yearly is really important. And then there's another one. There's one more. Oh, and then there's the HPV. This one has become a lot more common because it actually causes cancer, cervical cancer. It's common. It's not as uncommon. There's a vaccine for it that you can take to prevent it. If that is something that you feel comfortable with and you're afraid of it, then you do you. I personally chose not to, but I'm not going to get into that conversation here right now. There is something to prevent it, but it's not a cure for all HPV. There's a lot of them. There's over, I think, 100 different types of HPV. And almost everybody will have this in their lifetime. And the good news is about HPV is that your body can, most of the time, it's undetected and you'll never know you had it. I think almost everybody's going to have HPV in their lifetime unless you have had sex with one person and you both were virgins and that's it. And you've never had sex with anyone else and you've been tested. But HPV is really common and there's over 100 different types. But the cool thing about it is your body fights it. And if you have a strong immune system, you drink lots of water, you don't drink a lot of alcohol or sugar or toxic ingredients or chemicals or preservatives, if you're taking care of yourself and really nourishing your body's going to fight it really easy. but sometimes it doesn't. And so it's important to get tested. That's why pap smears come in for women. If you're, I think it's under 45, I believe, you don't have to get pap smears for every 5 years. That's it, which are just uncomfortable and awkward, but it's important to get it. If you haven't had a pap smear in the last 5 years, I highly recommend next time you get STI tested, which hopefully will be soon, that you get a pap smear put in there as well and talk to your doctor about that. And then I never know how to say this one. It's or trichomoniasis. I did not say that. Trick is how you call it for short. It is, you can have discharge, itching, discomfort during urination or during intercourse, but a lot of people are asymptomatic. This one you could probably get confused with BV, which we'll go into in a minute. It can be treated with a drug, like a simple drug, and is easy to get rid of. It's important to get tested. Both partners get to get tested. All of these ones, everybody's got to get tested and treated if they're positive. Yeah. So I hope you guys got some clarity on it. Going to go over it really quick. We have chlamydia and gonorrhea, which are bacterial. And I believe syphilis is as well. Herpes is viral. HIV is viral. HPV is parasitic, I believe. And trich is parasitic as well. And they're easy to get rid of, except for HIV. And luckily, we have different medications. If you're afraid of HIV and you are very promiscuous, which a lot of people in the gay communities are, there are also there is PrEP, which you can take to prevent yourself from getting HIV. So if you want to be promiscuous and just go out and have tons of fun and you don't want to worry about it, you can take that. There's going to be its own side effects for that one as well. I'll go into a little bit in a moment of how to have the conversation with people, but it's really important to have these conversations, to speak about them. HPV, take care of yourself, take care of your health. If you feel like getting a vaccine is the way to take care of your health, you do you, boo. And getting tested. So I like Planned Parenthood. Get in, you pee in a little cup, you get out, they take your weight, talk to you for a second about your health history. If you got anything active going on down there, you want to do a pap smear and you're a woman, they're going to go in there and check things out. And then they'll do some blood. They'll take a couple of vials of blood and send it into labs. They usually say it takes a week to get your results back, but I've had my results come back in 24 hours. Just depends on the Planned Parenthood and the lab and how busy it is. That being said, it's important. I've said it so many times. I'm going to say it again. I want to program this into your brain. Get tested every single time you have a new partner and you don't use condoms. Get tested every 3 to 6 months, depending on how many partners you have. Unless you're celibate and you've been tested before your celibacy, you're going to want to get tested on a regular basis. I'm going to say something that's a little hard to hear because everyone wants to think that their partner is loyal, but a lot of people aren't. There's a lot of cheating that happens in our world, and to be proactive with your own health and responsible for your own health, it's really important that you get tested. You can have the conversation with your partner and say, hey, I'm going to get tested. Do you want to go with me? It's just for my own personal empowerment. Being in the know is scary. Going into the office and sitting in a little chair and lights are all crazy and you got to go in there and it's uncomfortable and it sucks and it might cost you some money and all of the things. It's probably not something you want to put on the primary first thing you do. And you're going to feel powerful knowing what your test results are, whether they're good or the bad, they're ugly, at least. And as I've said, the longer you wait, if you have an STI and you don't know it, That is when they're dangerous and bad and scary, is when they go untreated. I'm just going to drink a little bit of water here. I'm going to say something vulnerable about myself on the air right now. I am not monogamous. I am ethically non-monogamous. And what that means is that I have more than one partner at a time. And when I started doing this was the scariest was STIs. And so I went into Planned Parenthood, and because I'm very curious and I'm a sex coach and I like to know things, I sat down and I said, talk to me about this. I'm opening my relationship dynamic. I'm going to sex parties. I'm having multiple partners, and I'm petrified of STIs. And the doctor said that actually, I don't know if this is true everywhere. This is in Southern California, but this is what she told me. She said that poly and open relationship individuals actually have a tendency to spread STIs less than monogamous, that serial monogamous people do, because a lot of times serial monogamous people don't get tested. So they'll be in a relationship with somebody, that somebody didn't get tested, they had sex, they were together for a while, didn't get treated, didn't find that they had it, then they go to the next relationship and spread it. Because they were only with one person, they didn't get tested. So I was really surprised about that. And the reason is that people who are in poly and open communities get tested more. They talk about it more. And they're more confident about communicating if they have anything, especially herpes. And so I was shocked when I heard that. And I'm not trying to get you to be ethically non-monogamous or poly, but I am trying to get you to talk to your partner about it and to go get tested. Because if you've been with somebody and you haven't been tested since you were with them, go this week, go ASAP and have that conversation. Be like, hey, Rose said that it's better to catch it and take care of it than it is to let it go long. I just want to be proactive with my health. I'm going to go make this appointment. Do you want to go with me? We can do it together and we can just know, right? So that's really important. That being said, if you're not in a relationship and you're having fun and you're wanting to explore with multiple people, you're going to want to use some condoms. Or if you're sleeping with somebody who hasn't been tested, if you're having that conversation and you're like, hey, have you been tested recently? And they're like, no, you're going to want to use some condoms. So actually, I'm going to role play a little bit for you on how I suggest that you have this conversation. These are the factors that you're going to want to have with a new partner. You're going to want to, say, do this before anything gets hot and heavy. So let's say you're out on a date for the first time or the third date or whenever you think that things might start getting spicy and heating up. You're going to want to do it before they get spicy and heat up. You want to make sure that the sexual turn on isn't active. And you want to say, hey, I'm just curious, when was the last time you got tested? No, I'm going a little too far in. So it's, hey, I'd love to talk about health because that's important to me. I am interested in making sure that I'm healthy and that you're healthy. So I'd love to have this conversation about the last time that we got tested so that we can be proactive with our health. I'm just curious, have you been tested recently? And then they can say, yeah, or I don't know, not recently, or anything like that. And if you've been tested recently, you can say it, right? I've been tested. I had my results back. I'm clean, or I had herpes. And just so you know, the other thing you want to know is if they're like, yeah, I got tested 6 months ago, you can say, okay, how many partners have you had since then? And did you use protection? So it's really important to have these upfront conversations, to be consenting to the experience, because it's really, I know it's kind of a little awkward to say it upfront, but it's way more awkward to get an STI and have to have that conversation with a person. So making sure. So if you're not certain that and like also if you're not on birth control and you want to protect yourself in that way as well, condoms are great. And if you want to make sure to protect your health, my suggestion is to have a boundary that you won't have sex with somebody new without a condom until you guys have both been tested recently. And there's nobody in between you and them, and that you communicate and talk about it. If that is something that you haven't had, or you guys haven't had testing recently and you're really wanting to have fun, make sure to use a condom and to be responsible with using a condom. I know condoms are not the funnest, and they're a lot better than getting an STI or getting pregnant. I'll just be real with you. Like, condoms suck, but like STIs and pregnancy sucks way worse. So in the heat of the moment, yeah, it's not going to be so much fun. And it's important to use them. There are a lot of different types of condoms out there. If you've tried a condom and you don't like it, try different ones. Get creative. Honestly, I'm really sensitive. So certain condoms have like chemical lubes that don't work for my body. And so I also don't do well with latex. If you are using latex condoms, make sure that you don't use oils because that can actually break the condom. But you want to make sure to try different ones until you find one you like, because you can, I'm going to say this clearly, please listen. You can have great sex with condoms. You can have great sex with condoms. Lube helps. I know there's a lot of stigma. I actually didn't use lube personally as much as I do now before my sex coach training. And I was actually really surprised because I was like, why haven't I been using lube? Lube is amazing, you guys. It's amazing. With or without condoms. If you have a partner that's both been tested, you're not using condoms, lubes is great. It's really great. With condoms, make sure you're using the right size there. And then make sure also when the condom is going on that you pinch the tip of the condom so that there's not an air pocket. That's a huge reason why condoms break a lot. I feel like I should be having my banana in my sex ed class and showing you how to properly put on a condom. Anyways, if you're sensitive to latex or have a latex allergy, there's non-latex condoms. When used correctly, condoms are the most effective form of birth control and also 98% effective at preventing STIs. They also, I do want to be clear here, you can get herpes when using a condom. So make sure that if you have herpes or that the person you're having with, make sure there's no outbreaks. Lube is super awesome. I love it. If you've never used it, please go buy a bottle today. Lube is super fun. It's great for self-pleasure. It's great for pleasure with your friend. Even if you get really wet and juicy, it's still fun and you want to use it. There's three different types of lube. There's a water-based lube and a silicone-based lube. And then there's one that's water and silicone. Water-based lubes are great for condoms, but they have a tendency to dry out quicker. Then and the silicone-based ones are good for when you're having fun in the water, like the shower or pool. They're also a lot better for lube or anal. They should not be used with silicone toys, though. They can wear them down. One of the things I do want to talk about is making sure that you use clean lube versus chemical lube. I know a lot of people don't talk about this. There's certain ingredients like glycerin, propylglycol, or parabens that are in many mass-marketed lubes that can cause yeast infections, bacteria vaginosis, irritation. They're chemicals you don't want to put in there. A lot of natural lubes are made from aloe vera, coconut oil, or shea butter. And if you're using a latex condom, make sure not to do the coconut oil because that can break that down. Organic lubes also are really good I like Good Clean Love. That's my favorite. It smells like a vanilla and it's tasty and smells yummy. And feels good on the body. Chemical lubes can cause yeast infections and bacterial vaginosis because they're going to change the pH of the vagina. And then the organic ones are actually better at balancing out the pH. It can cause different allergic reactions. Most of the lubes in the sex stores or on the internet have a lot of chemicals in them, so just read them. I would suggest buying organic lubes and finding one that works for you. Okay, let's talk about statistics on age. This one's fascinating. Adults ages 15 to 24 years old, young adults, 15 to 24 are half of all new STIs in the US. Basically, they're getting it on without condoms a lot. And they're probably on birth control, so they probably don't think they need to use condoms. They have increased sexual activity and a lot less condom use. So if you're aged 15 to 25, please go get tested. You can do it. You're allowed to at that age without your parents' consent. If you're under, I think it's 16 to 18 you can go, I believe. I have to check it out in California. Check out the Google and ask. Ages 25 to 34 are not as high as young people, but they are pretty high because they have increased or multiple sexual partners. And then the other interesting one that I found while I was doing research for this is older adults, actually, ages 50 plus, who are getting divorced. They've been married for a really long time with the same person. They're getting divorced. And a lot of times, like especially women at 50 years or older, can't get pregnant. So they don't think about condoms because maybe they've been married for 25 years and they didn't use a condom. So actually the elder generations STIs are on the rise. So if you are in the elder ages, please also, again, go get tested and have the same conversation. If you're 50 or 15, or I hope you're not having sex younger than 15. But if you are, you're having sex at any age, any age you are, please have these conversations and go get tested. The gay and bisexual men have the highest rate of syphilis, gonorrhea, and HIV. So making sure if you are gay to be taking PrEP, if you're going to be having fun without condoms, making sure that is something that you do. So I hope you had fun. I hope you learned something in this evening all about proper education, treatment and protection, communication, effective connection, making sure that you use condoms. If you're going to use condoms, use lube. So much better, I promise. It sometimes can be like almost nothing's there. There's a lot of different types of condoms that are really thin. There's new science coming out with them. So choose clean, safe lubes. To say confident, eat healthy, take care of your immune system, take care of your body. Remember that your body is sacred, and it's taking the time to care for it through informed decisions around protection, treatment, and communication is really key. Stay empowered, stay informed, and take care of yourself and your partners. Thank you so much for listening to KXFM, Laguna's Community Radio. This is Rose Heartsong, and this is Follow Your Heartsong, where we talk about taboos around sexuality. And so that's what you chatted with me tonight about. I'm so grateful that you tuned on. If it wasn't for you, the listener, the show wouldn't matter.
You felt that, didn't you? Let it sink in, take what you need, leave the rest, and always trust yourself. If this spoke to you, please follow, like, and share. It helps the message reach those who need it. Stay wild, stay free, and keep following